When we harm each other interpersonally through violence or trauma, terror, trafficking, there are health consequences to that trauma, and there are psychological and psychiatric consequences to that. So I think about trauma in ways if we can cause trauma by the way we interact with people. Maybe we can heal people in the way we interact.
It is estimated that there are 40.3 million trafficking victims worldwide. They have been removed from their families, sometimes their country. They have been forced, they have been used, and ultimately left without support.
The UN definition of human trafficking is harboring, receiving, transferring of persons through a means of force, fraud, and coercion for the purpose of labor or sex trafficking. That doesn't mean somebody has to actually move locales. Sometimes patients are trafficked in their own homes by people they know. There are models that predict upwards of 313,000 persons trafficked in the state, 234,000 of which are labor trafficked. Texas has done some very interesting and unique things around the trafficking space. For example, they've passed a bill that requires healthcare professionals to receive training in human trafficking.
That is important to us to do that training.
This is a human trafficking 101.
The more trainings we have, we've seen an increase in the number of trafficked victims identified in our healthcare system. We've also seen an empowered workforce who is able to identify and not only identify but care for victims. Not just care that is immediate in the healthcare setting, but care that really addresses some of the social determinants of health that we see in our communities. Lack of housing, lack of resources, lack of employment.
To combat the problem,
Houston does a really good job of talking about trafficking in the healthcare system, in schools and communities. The city has a comprehensive strategy to address trafficking across prosecution, nonprofit support, as well as public health interventions.
With trafficking, the person is never making the choice. They're defrauded, coerced, or physically forced to do this. They're a victim. The thing at the core of it is money. If you're selling someone for sex, you can do it multiple times a night. If you're hiring construction workers where you're not paying somebody, you're also standing to profit more. And so at the core of it is a corrupt human being that is wanting to profit off of another human being. The Mayor's Office of Human Trafficking was created in June 2015. What we realized was that there was tremendous opportunity to address trafficking from a municipal perch. The first thing we wanted to do was institutionalize the trafficking response across city departments. So for the health department, we incorporated screenings because they see a large population that's often indigent, and that's a vulnerable group. We also instituted with Baylor College of Medicine and Ben Taub Harris Health the first human trafficking psychology fellow and the first human trafficking hospital case manager to help you get your medical appointments, and the psych fellow to treat all of the different things that come with the trauma of being trafficked.
People's cultural and interpersonal life experiences may influence how they see their exploitation and how they see their relationship with their doctor and how they see their healing process.
Police is the traditional way that trafficking victims are recovered. Not everyone is going to want to talk to police. And in about 2017, there was a small study conducted of trafficking survivors, and 88% of them at that time said that they had been in an emergency room and gone undetected by a medical professional.
They have been neglected, they have been abused, they have been exploited. And we as healthcare professionals, our goal is to identify them and help them along the way. Not just pass by and see an act happening and not address it, but to show compassion, which is an underlying principle in our ministry at Common Spirit Health and also at St. Luke's Health here in Houston, Texas. No one organization really can do this work alone. It really takes a collaboration of several different organizations to maximize the resources and to be good stewards of those resources. The PATH Collaborative and St. Luke's Health, our goal is to really eliminate the barriers. When trafficked victims are identified, there are usually several barriers. Are they citizens? Do they have insurance? Can they speak English? All of those can be barriers to provide care.
Kimbely Williams had reached out to our corporate offices to see if Marriott could collaborate in the city. So we started by looking at a donation drive for the survivors that come to St. Luke's. 15 to 20 hotels were able to receive donations, toiletries, basic supplies, package them in backpacks. And this was given to the survivors as they arrived.
Some patients come into our hospital with absolutely nothing. Where do we start? We start with compassion, we start with care, and we start with a sense of peace and support.
Through the collaboration, I was able to hear from two of the survivors. It broke my heart to hear straight from them their experience, but that also helped me continue and increase my commitment to make sure that all of our Marriott family hotels are really invested in this collaboration. Historically, hotels have been an unwilling venue where these situations occur. For us, it's obviously important to be aware and to be trained to detect and deter so that we can avoid that happening in all of our hotels in Houston.
The hotel ordinance is a good example of how we regulate just one of the industries that touch or intersect with trafficking. It requires all of the 554 hotels and motels in the city of Houston to train all of their employees annually. And then once they do that, they have to certify with the regulatory agency that they used one of the pre-approved trainings on the city's website to train their employees.
The training focuses on awareness, deterrence, understanding the signs, reading the signs, and active reporting to avoid and deter. Just this past year, we reached 1 million employees fully trained on anti-human trafficking.
It is the latest case of sex
The biggest take-home message is that it happens in Houston and it happens to our Harris County citizens. It's not something that is rare or unique.
We're doing everything possible from a municipal lens and within the capacity of a municipality to address trafficking.
The mission of Common Spirit Health is to make the healing presence of God known in our world by improving the health of the people we serve, especially the most vulnerable in our community. And human trafficking victims happen to be some of the most vulnerable people in our community.
We tend to, unfortunately, not extend empathy beyond our line of sight. But these are our brothers and sisters. We're all connected. It affects every single one of us. And hopefully, it becomes as real for everyone as it became for me in interacting with the survivors.